Hey everybody, Dr. Zac here with the Spine Health Clinic of Chiropractic. We are on the sleep biohacking series and it is super fascinating. I hope y'all are super excited about it. So last time we talked about growth hormone. Don't eat carbs before bed. Take it one step further. Don't eat anything before bed and you can upregulate your growth hormone along with washing your brain, which is obviously going to be significantly important. I obviously probably don't have to explain the rationale behind that, but that is going to be some things that we covered in the past, which are extremely beneficial to your health and to the goal of living 100 years like you're 20 years old, right? And that's what we're all here for. So this series, we're going to be talking about mouth taping, which is really cool. I kind of want to share a little story. You see this little slit right in here? I might have not seen that slit when I first tried these. So what it does is you peel this off and you put it over your mouth and then you go to sleep. I didn't see the slit the first time I did it. So what I did was slept with no slit in it, and it was kind of scary. I just remember being in my dream and I was trying to breathe and I couldn't, but I was far enough asleep where I couldn't wake up, but I couldn't breathe, but it was kind of scary. But there's a slit for a reason, and these aren't scary, and you should use them, and they're really cool, and we're going to talk about why. And it's all about diaphragmatic breathing. Diaphragmatic breathing, super fancy term for just saying to breathe through your nose. Your body was designed to have two openings, and we tend to use this one to breathe more than we should use this one. This one was actually designed to breathe, and the way that it functions and the way that it's more beneficial is diaphragmatic breathing is going to be triggered through the nose. And what that allows you to do is you have the diaphragm down here, and when you breathe in through your nose, it's going to allow that function to be more properly dictated. When you breathe through your mouth, what happens is you use a lot more muscles up here and here, and it's shallow breathing. The air literally just goes from here to here. It's like you're a dog, and 20% of the oxygen is actually up in this upper diaphragm area here. So that is going to be a significant reason on why you breathe faster when you breathe through your mouth, because not much oxygen is being diffused into the bloodstream. When you breathe through your nose, your body has to really pull the diaphragm down. 80% of the oxygen is going to be in the lower lobes of your lungs. So when you're I can't catch my breath, I can't breathe through my nose, I have to breathe through my mouth, you're just not used to it, because if you did breathe through your nose, you would actually get a lot more oxygen transfusion into the blood. So what you're trying to achieve is actually more beneficial, and you would be able to survive. If you did breathe through your nose, you're just not used to the habit yet. So develop the habit in that sense. But diving back into the sleep component of it is, not only does breathing through your nose allow you to have more blood diffusion and oxygen diffusion in the lower lungs, also strengthening the diaphragm, it also helps upregulate the parasympathetic state in your body. Fancy term for just basically chilling out. So a lot of yoga professions and meditation, you breathe through the nose and you exhale, and there's a lot of things that are going into that, but I'm going to keep it pretty simple. And what it does is it's just going to be able to upregulate the chill outness of you, which is going to be beneficial for quite a bit of you, because in this sympathetic or stressed out state that we all live in, having that chill out state or that parasympathetic influence is going to be very beneficial. So when you sleep at night, not only does having your mouth shut prevent cavities, because dry air on your teeth is actually kind of what happens when you have sugar on your teeth, and then it's air, and then you don't have any saliva, and then you get cavities. Completely irrelevant, but I just want to touch on that. I'm not a dentist. But you also are able to strengthen the diaphragmatic breathing, which is going to be a habit, which is going to allow you to do it further, and it's going to allow you to do it throughout your day. So you actually kind of keep a more calm state. You actually filter a lot more of the air that goes through your nose, and the most important thing is going to be the nitric oxide production. It is going to be extremely upregulated, I guess you could say, or there's going to be a lot more production of nitric oxide. And what is the significance behind that? It is a very potent antioxidant, but it also allows vasodilation, or just basically the regulatory processes of your blood vessels to open and close. And that's going to be very good, especially in a whole plethora of visits. But all we have to say is that it's going to spike your NO2 production, your diaphragmatic breathing is going to improve, your habits for breathing through your nose are going to improve, and it may or may not help reduce cavities. So all of that stuff is kind of diving into using mouth tape. And I think it is a very cool, beneficial thing that is very inexpensive. And if you're already doing it at home, then you're fine. But if you're like me and you snore and you breathe through your mouth and you wake up and your mouth is super dry, you're not only robbing yourself from oxygen, so you may be actually in a hypoxic state, which is not going to be very beneficial for your brain when you're kind of just like panting when you're sleeping and you're not getting the oxygen that you need in order to have this thing functioning at an optimal level. So you're not going to be that well rested when you do wake up. So it's just this whole snowball of events. So breathe through your nose, especially throughout the day or just whenever you're consciously aware of it, which is going to be very beneficial. It's going to upregulate that parasympathetic chillness that we all need. And then obviously the mouth tape here, if you're not breathing through your nose strictly at home, is going to be a huge perk. Use the little bit of a slit in here. It'll save you. And that's just going to basically just develop the habits of allowing you to breathe through your nose, which will help with everything. So that is going to be a biohacking tip right there. Mouth breathing is a thing of the past. You got to get rid of it. We have a nose for a reason and we have to use it. So hope this video was helpful. And like always, it's been a pleasure. Take care.